Welcome back. It's something that you might be seeing on your social media feeds quite a bit. Videos that are focused on your gut health. Once you get through those at-home remedies, there's an important takeaway that you should know, that taking care of your gut is important. So Dr. Diana Bitner is here to explain why, talking about our gut, and of course it's Colon Cancer Awareness Month, so a great time to dive into this topic. Thanks for being here with us.
Thank you.
We always hear it's a good idea to take a probiotic. First, what is that and why is it a good idea to do?
So a probiotic is actually the bacteria that make part of our biome. Our biome is all the bacteria, the fungi, the viruses that live in our system and actually help us function. So a probiotic is actually the bacteria.
And then I also see sometimes prebiotic, which can be confusing for people if they don't know the difference.
So prebiotic is actually the food that the bacteria need to survive. It's the food they eat. So a prebiotic mainly is fiber. And so like if you think of eating a piece of celery, there's not a whole lot to it, right? Except insoluble fiber, like straw, right? So the bacteria actually eat it. So that's an ideal I can't even remember, a prebiotic to make it all the way down to the gut so those important bacteria can eat it.
Yeah, and to further confuse people, I mean, we've got probiotic, prebiotic, and then a postbiotic.
Are the actual products that the bacteria make. So, you know, as I've dove into the subject to even prepare for today and to learn more, I'm fascinated. It's so complicated. But the bacteria actually make, for example, in the colon, butyric acid, which is like lactic acid, butyrate, I'm saying it right now. Butyrate actually feeds our colon cells and it helps reduce colon cancer cell growth. So people that have more butyrate in their colon likely have a lower risk of colon cancer. So one of the things we talk about is like, why are all these young people getting colon cancer? You know, colorectal cancer, we worry a bit about HPV, the virus that causes cervical cancer, can also cause lower colorectal cancer. But, you know, is this whole concept of a low fiber diet increasing our generation's risk for colon cancer?
So fiber, of course, so important to balance and make sure we've got the good gut health. What are some of the, I don't want to say superficial, but what are some of the immediate benefits that you might see? I mean, reduce bloating, I mean, maybe even lose a little bit of weight?
Maybe so. Like, again, it's supporting those bacteria. And so, you know, some people, let's say you and I go on the same diet, maybe you lose weight, I don't. It might be because I don't have the right bacteria in my gut to help process the food correctly. Right? So then we get to what you and I were talking about before is, what do we take in terms of a prebiotic? A probiotic, the bacteria. What do we take in terms of the bacteria?
Well, how does this all apply to Jane?
So good way to segue is that Jane's dad had colon cancer. He had a lot of colon polyps. She started her colonoscopies at 40 because he had colon cancer at 45. So she started her colonoscopies early. She had lots of polyps herself. And so she was on the every 3-year plan. So she's like, how can I help reduce my risk? So one thing that Jane started doing, we talked about it, is adding a lot more fiber. So we went through her diet. She was only getting about 10 grams of fiber. And so she was eating, let's say, a muffin for breakfast. She was having a sandwich with white bread at lunch. And at dinner, she was having white rice and meat. So there wasn't a lot of fiber in her diet. She was eating fruit, which is pretty low fiber, unfortunately. And so we increased her fiber to about 35 grams of dietary fiber. And then on top of it, she started taking a prebiotic.
That's a lot of information, but the takeaway really is we have to focus on our gut health. It's so important. Thank you so much for all of your information. There are some takeaway tips right there on your screen. Thank you so much, Dr. Bitner.
Thank you.